So I'm gonna do a 360 of the room. I'm gonna set my camera down. Okay. Hi, my name is Amanda. I'm gonna be a nurse today. I'm gonna wash my hands. I'm gonna provide patient privacy. So before I entered the room, the tech came in and did your vital signs, and your vital signs were within normal limits. The tech also did a visual acuity test using the Snellen chart, and your vision was 20/20 vision. That tests cranial nerve 2, which is your optic nerve. Could you tell me your name and date of birth?
Khalil Lewis, 120411.
Okay, thank you, Khalil. Do you have any allergies to any medication?
No.
Okay, thank you. Do you know where you are today?
I'm at the doctor's office.
Okay, and do you know what year it is?
2026.
Okay, and do you know why you're here today?
For a physical.
Okay, how are you feeling today?
Good.
Okay, do you have any pain?
No.
Okay, patient is alerted or reenters times 4. I'm going to go ahead and start my physical assessment. Is it okay if I touch you?
Yes.
Okay, I'm going to start with your head. So, I'm touching the patient's face. Patient's face is normal for his ethnicity. It is dry and warm. We're going to go ahead and start touching your head. I don't see any lesions. Hair is evenly distributed. No signs of infestation. Okay, so now I'm going to go ahead and I'm going to look in your eyes. I'm going to use my pen light. So I'm going to flash the light. Eyes are symmetrical. No redness noted bilaterally. Now I'm going to check your ear. Ear canal is pink and serum is present. I'm going to check the other ear. Ear canal is pink and serum is present. Okay, so now I'm going to go ahead and look in your nose and mouth, so I'm going to have you look up. Okay. Nears are patent and pink. Okay, open your mouth for me. Okay, mouth is pink and moist, and teeth are intact, no lesions or bleeding noted. Okay, I'm going to go ahead and I'm going to assess your neck. So I'm going to look at your neck and I'm going to check your trachea. Then I'm going to feel your trachea. Trachea is midline. Okay, so now I'm going to go ahead and feel your thyroid. I'm going to step behind you to do that. Okay, thyroid is palpable. Nodules are non-palpable. Okay, I'm going to have you go ahead and swallow for me. Okay, thyroid moves upon swallowing. So now I'm going to assess your lymph nodes. So you have your pre-auricular, post-auricular, occipital, retropharyngeal, submandibular, submental, anterior cervical chain, posterior cervical chain, and supraclavicular. Lymph nodes are non-palpable. Okay, so now I'm going to go ahead and assess for a carotid root. I'm going to use the bell of my stethoscope. I'm going to have you hold your breath. Take a deep breath in. Hold it. Breathe. No root is noted. I'm going to check the other side. Inhale. Hold your breath. Okay. No. Exhale. No root is noted. Okay, so I'm going to go ahead and feel your carotid artery. 2+. Okay, I'm going to check the other side. 2+ bilaterally. Now I'm going to assess for JVD, so I'm having you look, lean back at a 45-degree angle and turn your neck that way. Shining the light, no JVD noted. I'm going to do the other side. Lean back and hold your neck. No JVD noted. Okay, so now I'm going to go ahead and start with your cranial nerve. So we're going to start with cranial nerve 1, which is your olfactory nerve. So I'm going to have you go ahead and close your eyes and plug your nostril for me. And then I'm going to hold up a scent. I want you to tell me what you smell. What you smell?
Strawberry.
Okay, now I'm going to do the other side. What you smell?
Orange.
Okay. Cranial nerve 1 is intact. We already assessed cranial nerve 2. So we know that cranial nerve 2 is intact. So now we're going to go ahead and assess cranial nerve 3, which is your oculomotor. And I'm going to do perla. So I'm going to shine the light. I'm having you look at me. Pupils are equal and round and react to light and accommodation. So now I'm going to assess cranial nerve 3 is intact. I'm going to assess cranial nerve 3, 4, and 6, oculomotor, trochlear, and abducens. So with 3, 4, and 6, 3, 4, and 6 are going to be the 6 cardinal fields of gaze. So I am going to start here, bring the pen over, up, down, start here, bring the pen up, down. Okay, cranial nerves 3, 4, and 6 are intact. So we're going to move on to cranial nerve 5. This is a trigeminal nerve. So I'm going to have you open and close your mouth. Okay, and then I'm going to open, feel, and I want you to open and close your mouth. No popping, no clicking, noted. So now I'm going to have you close your eyes, and I'm going to feel, and I want you to tell me when you feel me touching you.
I feel you. I feel you. I feel you. I feel you.
Okay, cranial nerve 5, trigeminal nerve is intact. Now we're going to test cranial nerve 7, which is your facial nerve. So I'm going to have you raise your eyebrows, puff out your cheeks, and give me a smile. Okay, cranial nerve 7, facial nerve is intact. Now we're going to do cranial nerve 8, which is our vestibular cochlear, and there's going to be 2 tests. One is going to be a whisper test, and the other is going to be a rumble test. So the whisper test, I'm going to have you plug your ear, and I'm going to whisper 3 words, and I want you to tell me what I said. Blue, yellow, green.
Blue, yellow, green.
Okay, I'm going to do the other side. Brown, pink, yellow.
Brown, pink, yellow.
Okay, alright, so whisper test is normal. So now I'm gonna go ahead and do our rumble test, and I'm gonna have you stand up. You're gonna put your legs together, put your arms by your side, and you're gonna close your eyes. And I'm just gonna make sure that you don't fall. So I'm gonna check to see if you have any sway or balance issues. I will do this for 1 full minute. Okay, so this test is a negative rumble test, so you can go ahead and sit down. Cranial nerve 8, the vestibular cochlear is intact. Now we're going to assess cranial nerves 9, 10, and 12. 9 is pharyngeal, 10 is vagus, and 12 is hypoglossal. Okay, so for 9, I'm going to have you open your mouth and stick out your tongue. I'm testing for gag reflexes. Okay, 10, I'm going to have you swallow. And then 12, I'm going to have you stick your tongue down and put it in both your cheeks. Okay, cranial nerves 9, 10, and 12 are intact. So now we're going to do your accessory nerve, which is cranial nerve 11. So I'm going to have you shrug your shoulders up and down. And then I'm going to do it with resistance. Okay, cranial nerve 11, accessory nerve is intact. So now we're going to check for gait. I'm going to have you walk 5 steps forward, heel to toe, and then I want you to walk 5 steps backward. Okay. Gait is steady. So now I'm going to assess your cerebellum. So I'm going to do your upper and lower cerebellum. So for upper, I want you to just do like this. Okay, upper cerebellum is intact. So now for your lower cerebellum, I want you to take the heel of your foot and ride it down your chin. Okay, same thing on that side. Okay. Lower cerebellum is intact. Okay, so now I'm gonna check your look at your chest. I'm gonna check in for respirations are even. No labor. No signs of labor breathing. No signs of barrel chest. So I'm gonna go ahead now and I'm gonna touch your skin. So I don't feel no edema present. Skin is normal for his ethnicity, and it is warm and dry. I'm going to check your skin tugger. Skin is elastic. So now I'm going to assess your pulses, your brachial pulses, and your radial pulses. So you stretch your arms out for me. I'm going to check your brachial pulses bilaterally, 2+. Now I'm going to check your radial pulses. It's going to be 2+ bilaterally. Okay, so now I'm going to assess your range of motion and your muscle strength. So I'm going to have you bring your arm up, and then I want you to bring it down. Okay, now you're going to do that with resistance. Bring your arms up and bring your arms down. So now I'm having you bend your elbows for me, and then I want you to extend them, and then I want you to do the same thing with resistance. Okay. Range of motion is intact, and muscle has full strength. So now I am going to check your reflex tendencies. So I'm going to check your tricep. Okay. Now I'm going to check this side. Okay, now I'm gonna do your bicep reflexes. Alright. Bicep reflexes are intact. Now we're gonna do your brachial, brachial reflexes. Okay. Now we're gonna do your patella. Okay. Okay, all the reflexes are intact. Now I'm gonna do cap refill. So, each index finger cap refills less than 3 seconds. So now I'm going to listen to the heart and lungs. I'm gonna listen to your heart sounds. So, aortic is second intercostal space, right sternum, border S2 louder. Pulmonic valve is going to be your second intercostal space, left sternum border, S2 louder. And then I'm going to do your Erb's point, so I'm going to change to the bell, and it's going to be your third intercostal space, left sternum border, S1 is S2. And then I'm going to flip it back around to the diaphragm, and I'm going to listen to your tricuspid. It's going to be your fourth intercostal space, left sternum border, S1 is louder. And then I'm going to listen to your mitral valve. It's going to be your fifth intercostal space, left mid-clavicular line, S1 louder. And I'm going to go ahead and listen for 1 full minute for apical pulse, and I'm going to have the patient lean forward. Okay, and now I'm going to go ahead and check for a pulse deficit. I'm going to listen to the carotid pulse. Okay, no pulse deficit. So now I'm going to go ahead and listen to your lung sound. I'm going to start posterior, and I'm going to listen. It's going to 8. So take a deep breath for me. 1. I'm going to turn your chair around. 2, 3, 4, 5, 6, 7, 8. Alright, I'm going to turn you back around. Now we're going to do lateral on the right. We're going to listen to 3 spots, and on the left, we're going to listen to 2 spots. So I'm going to have you lift your arm up for me. 1, 2, 3. I'm going to listen to the left side. It's going to be 1, 2. Alright, lungs are clear, posterior and laterally. Now we're going to listen to anteriorly. I'm going to do 6 spots. Take a deep breath. Take a deep breath. 2, 3, 4, 5, 6. Alright, lung sounds are clear. So I'm going to assess your respiratory expansion. So I'm going to do the butterfly technique. And I'm going to have to take a deep breath in. Normal chest expansion. Now I'm going to go ahead and assess your abdomen. So I'm going to have you lay on this couch for me. Okay. And I will do this on bare skin. Hold on, wait. So I will do this on bare skin. It looks like the abdomen is flat. There's no lesion or scars, and no bulging. So I'm going to go ahead and auscultate for bowel sounds. And I'm going to start in the right lower quadrant, and then I'm going to go ahead into the right upper quadrant, and then I'm going to go to the left upper quadrant, and then I'm going to go to the left lower quadrant. Okay. After the bowel sounds are heard, I will listen for 1 minute in each quadrant, and if no bowel sounds are heard, I will listen for a total of 5 minutes. So now I'm going to go ahead and percuss in the same direction. So right lower quadrant, right upper quadrant. Okay, tympani is heard. And now we're going to palpate it. Just tell me if you feel any tenderness. abdomen is soft. You can go ahead and sit back in that chair. Okay, at this time I will have you take your shoes and socks off. Shoes and socks are already off. So I'm just gonna raise up your pants leg. I'm gonna check your skin. No edema is noted. Skin is warm and dry, and this color is the right color for this patient's ethnicity. So I'm not gonna check your range of motion and muscle strength. So I'm gonna have you extend your legs for me, stretch them out, bring them up. Like this. And then bring them back. Now I'm gonna have you do that against resistance. Okay. Okay, now I'm gonna have you flex your feet. Okay. So now I'm gonna have you push up. Okay. Now I'm gonna check your pulses. We're gonna do your posterior tibialis. And then it's 2+ bilaterally. So now we're gonna do your dorsal pedius. And that's 2+ bilaterally. So now I'm gonna check your cap refills on your toes. I'm gonna touch one of each of your big toes. Okay, cap refills is less than 3 seconds. And that concludes my physical assessment.